I retired in June 2006, and this was great. This is going to be summer all year long. And so we we planned a lot of trips. I used to play tennis 5 days a week, and I was on a tennis team, and we'd compete around the neighborhood, around this area. We loved having Thanksgiving dinner at our house. It was very traditional. We would have the turkey, scalloped potatoes with lots of cream and garlic, and then spinach timbal. That was something. Julia Child is my role model, and that was one of her recipes.
As time wore on, I became more and more a chef myself, and so I've learned a lot from her.
Yeah, after I got sick, he became the chef. Before that, I did everything.
Right.
Yeah. So the day I started to feel weird was about 1.5 years after I retired. We got home, I walked through the front door, and I don't remember anything after that for about 2 months. It was just gone.
So I get her down to the ER. This is about 8 o'clock at night, I believe. Couldn't get anybody to pay attention to us. We were in an ER, and yet everyone was doing other things. I couldn't find a doctor. She really didn't get looked at by the ER staff until hours and hours later. During that time, her skin started to change color, and she was just as delusional as ever, getting worse, in fact. Finally, about 2 a.m., they came in and said they'd run some blood tests and that your wife has to go to another hospital, a bigger hospital, to get treatment. So in the middle of the night, we took an ambulance where they admitted her to the ICU. The earliest diagnosis was meningitis. I don't remember exactly, but it took several days for them to conclude that it was what they call toxic shock syndrome, not sepsis. They never said sepsis. It seemed like there was a new crisis every single night. One of the first nights, her kidneys began to fail, and she was put on continuing dialysis. Another time it was pneumonia. Another time it was infection, hospital-style infections that are resistant to antibiotics. It seemed that at every turn there was some new development which was not good. The other thing that I remember vividly was the night that a team of doctors came in, and they looked at her limbs, and her limbs were literally turning black. And that's when I knew that amputations were in the future.
I do remember making a decision, and it wasn't, I guess it was conscious, even though I was in a coma. And sounds weird, but so there was just a dark side, and then there was this little patch of turquoise, bright turquoise, and I decided I would take the turquoise. And so that was basically my decision to just keep plugging along and survive. Yeah, it took me a while to get back into the kitchen because these legs are not very comfortable to stand in. And so standing for even more than 10 minutes was exhausting. Yeah, and one thing that Julia says, my role model, she says you have to have a what the hell attitude in the kitchen. And so that's why, things fall or they flip, and I just can't worry too much. But now, 5 years later, I can stand the whole time, and I can do it all by myself, basically.
The word sepsis was really not mentioned, except fleetingly, weeks later. And looking back on it, I believe that this has been one of the biggest problems surrounding the disease, which is that it goes by many different names, and as a result, it isn't accurately diagnosed, it isn't accurately recorded. That sepsis is a very expensive illness for the hospitals to deal with because it takes so long and there are so many complications and how it snowballs. that unless it's nipped in the bud, so to speak, it can really cost a lot of money in healthcare to save a person's life who has sepsis.
Yeah, I calculated it, and to be there that long with all the care that I had to be at least $1 million. And that was 8 weeks. That doesn't count the rehabilitation time.
And it's only been recently that the number of sepsis cases has become apparent in the United States, where they've collected all the data and now realize that it's a very big medical problem.